Let me introduce our first speaker, Dr. Lin from Taiwan. Dr. Shyr-Yeu Lin is going to present how to sustain IVF clinic operations during COVID-19. Dr. Lin graduated from Zhongshan Medical University, Taichung, Taiwan, and he received his PhD in Monash University, Melbourne, Australia, and has extended research and practice. He has been in Mackay Memorial Hospital and has been also in Taipei Medical University Hospital as assistant professor before his current position as vice superintendent in Taipei Fertility Center, Taipei, Taiwan. Let's welcome Dr. Lin and listen to how to sustain IVF clinic operations during COVID-19. Dr. Lin, please.
Hello, everyone. Good afternoon. I'm very pleased to attend this online symposium. My talk today is how to sustain IVF clinic operations during COVID-19. And first of all, I would like to thank Igenomix for inviting me to this online meeting. I am presenting my talk today by several parts as follows. I would like to describe COVID-19 epidemiology and pathogenesis. And then I would like to talk about governmental strategies. And also I will share some experience at TFT, Taipei Fertility Center. And so I will talk about how we do when the patient before entering the clinic or in public areas of the clinic. And I also will talk about managing IVF lab during this outbreak of COVID-19. And then I will talk about how we do before patient receive the procedures. And I will conclude my talk by talking about some possible impact of COVID-19 on fertility. Okay, so firstly, I will talk about the COVID-19 epidemiology and pathogenesis. And SARS-CoV-2, this variant, actually it contains a genome size of about 19 kilobases, and possesses nuclear capsid composed of genomic RNA and phosphorylated nuclear capsid protein. Okay, so you can see the cartoon figure here. And I will concisely talk about the COVID-19 epidemiology. COVID-19 actually is a type of self-limiting infectious disease. And most cases just have mild symptoms and can recover in 1 to 2 weeks. However, some cases probably have severe symptom side, and this proportion is about 13.8%. So from these figures, we can see that most of patients will have upper respiratory tract symptoms. Okay, so the most common symptoms are fever and then cough. Fever, this symptom side constitute about 87.9%. So actually, we can screen the patient using fever and cough, these two symptom sides. Currently, respiratory droplets and contact transmission are considered to be the main transmission routes. And for this COVID-19, the mortality rate for males and females was about 2.8% and 1.7% respectively. However, if the patient, who do not have severe disease or any basic disorder, the mortality rate actually is quite low. It's about less than 1%. However, if the patient who have cardiovascular disease, diabetes, chronic respiratory disease, hypertension, and cancer, the mortality rate probably more than 5% and close to 10% probably. So that we should take care of that for some patient with some systemic disease. And then I would like to talk about the global impact of COVID-19 on infertility service. So we can see here, if we have some question to ask and to do some statistics around the world. Okay, the question showing here, has your country modified its policy regarding fertility treatments along with the evolution of COVID-19 pandemic? So from here, this pie figure here, you can see 60% say yes, and only 40% is no. So including Taiwan here, okay. So Taiwan actually has very good control. About this COVID-19 pandemic. Then if we ask the other question, what is the status of listed reproductive technology centers in your country in relation to the COVID-19 pandemic? So we can see the figures left side, and about 82% country, the fertility center actually were closed or just limited access, and have 14.5% and infertility treatment can just provide it, like Taiwan, and only 3%. There are 3%. The fertility center has limited access. So Taiwan actually is very lucky in terms of fertility practice during the times of outbreak of COVID-19. So probably I can share some Taiwanese experience at this time. So what Taiwan government did. From this curve, we can show here the red curve is global statistics, and the green color is about statistics occurring in Taiwan. So we can see very clearly prevalence rate of COVID-19 in Taiwan actually is reached the plateau, and this disease already has been controlled very well in Taiwan. So what are the strategies in Taiwan? The slides show some strategy. Firstly, timely border control. So Taiwan governments had the border control at an early time. That's very important. And we also do some home quarantine, also home isolation. So if some people have some suspected symptom sign, the isolation is very efficient and important to confine this COVID-19 spreading out. Okay, so this is very important, and actually Taiwanese people cooperated with the Taiwanese government. So we did this, and we continue to do that very well. Also important because we, as I mentioned, the COVID-19, this disease transmission probably by or mainly by the respiratory droplet, air droplet. So mask is very important. If most people can wear face mask at the public places, it would be efficient strategy to confine this disease. So in Taiwan, the 4 major convenience store chains were integrated into the system, so that residents could take their NHI cards and go to more than 10,000 convenience stores to pre-purchase and pick up their mask. So this system we called name-based mask distribution systems. Also important concept is social distancing. So keep the safe social distancing, okay, and that will reduce the chances of infection. Okay, then I will share some our experience at TFC, Taipei Fertility Center. Okay, now I talk about when the visitors or the patients, when they should doing the things just as follows. First, when they before entering the clinic TFC, we have to check the points of body temperature. Firstly, at the second floor of the building, the clinic at the second point at the 4th floor of Weifeng Nanshan building. Yeah, and the visitors with fever will not be allowed to enter TFC. Oh, that's very important. This is screening strategy. So the visitor with fever, they will be transferred to the hospital and to further investigate or to see if there some risk of COVID-19 infection. And if the visitors who are allowed to enter TFC have to wear the face mask. Okay, that's a requirement here. Regarding in the public areas of TFC, we ask all the visitors have to wear the face mask. That's very important because even fever can screen out most of COVID-19 patients, but not 100. Okay, so we ask the visitors to wear the face mask. Also, in the public areas of TFC, we ask the patients or visitors to keep social distancing. Okay, now I'm going to talk about managing IVF lag. So as I mentioned, Taiwan actually control COVID-19 very well. So we are lucky, and we still practice and also provide IVF services as usual. So probably the IVF lab management, I just use some data from the paper and from the world. So this is a very good paper from RPMO, and it's discussing about managing the IVF laboratory during a pandemic. Okay, and from this paper, it mentioned 3 phases. If your country just encounter a very severe situation of COVID-19, probably should consider that. 3 phases. First one is shutdown preparation. Second, shutdown maintenance. Third, restart. And about shutdown preparation, so the manager of IVF lab or leaders should maintain staff morale and security through the formulation of business continuity plan, and should mitigate the risk of insufficient staff. Also, we should reassure the patient to reduce the patient's worry, and we should mitigate risk of contamination by patients. That's very important, and also should be very careful in mitigating risk of equipment damage, malformation, or loss of power. And about the shutdown maintenance, that's a very important point. The managers or the leaders should mitigate risk of liquid nitrogen or electric supply disruption and minimizing liquid nitrogen loss. Also should be careful to reducing risk of equipment malformation during shutdown, and also minimize risks for staff. For some country where the outbreak of COVID-19 has been controlled, probably should consider restart in providing fertility services. So in this stage, there are several important concepts. First, communication and documenting the laboratory restarting plan. That's very important, and should be careful and to know how to deal with viral contamination risk, and also should mitigate the risk of the patients as potential source of contamination, and also be careful about risk of biological samples as potential source of contamination. Of course, the staff should be have a very good recording about health in order to mitigate risk of staff as potential source of contamination. And environmental disinfection is also important. And this slide, I will talk about what TFC is doing. As I mentioned before, Taiwan now actually is relatively safe compared to other countries. So we do IVF lab actually usual. However, we are also very alert. I mean, in responding to any environmental changes. So we take many strategies in mitigating risk of staff as a potential source of contamination. So our staff should record their health condition. That's we think is very important. And the other, except that, actually we follow the standards of practice laid out by Shyr-Yeu for good laboratory practice in 2015. That's our experience now. And then I will talk about what we do when the patient receives some procedure. Okay, so the principle for us is that all the possibilities of infection should be ruled out before performing the procedures. So we announced this strategy quite clearly, quite openly to our patients, and our patients can understand that. Okay, so if the patients with some suspected symptom sign, we will stop the treatment and waiting for the patients actually recovered, or after we making sure the patient is okay, and we restart the protocol again. That's for good for all the patient reasons. Okay, and the last part, I would like to talk about some impact of COVID-19 on fertility. So we should consider at this stage, probably as many scientists around the world also do some research on reproduction. So what are impacts of COVID-19 on sperm, oocyte, embryo development, pregnancy outcome, even the whole reproductive systems? This question we should keep in mind and thinking. And for the extent of caution, how much careful we should be. Okay, so any evidence we should be alert and should update the information from the world. For example, whether COVID-19 can be found in semen or follicular fluid, whether gametes and embryos can be infected by COVID-19. What about the size of droplets in which the virus can be transmitted? The amount of time that the virus can survive on different types of surfaces, and whether the COVID-19 virus survives in liquid nitrogen. These points we should know in the near future. Okay, that's all for today. Thank you for your attention.
Thank you very much, Dr. Lin. I think we have a question from the audience here. Please answer the question for us. So, as we know that Asia is more controlled about the coronavirus, but in some other countries that the coronavirus outbreak is not controlled that well, and they need to stop the services. Is it possible that in this area the IVF centers can still run if they take the cautions? What's your opinion about this?
I would not suggest that because if the total environment is not good, your lab, your clinic will be influenced very easily. That's very dangerous, and it's unfair, also unfair to the patients. So I think the big environment is most important. It should be reach the extent of safety, and we can open our clinic. I think that's very important concept.
Okay, thank you, Dr. Lin. And also, what are the most efficient strategies in controlling COVID-19 pandemic? as what you see as a IVF doctor?
Okay, as I mentioned at the first stage of my talk, this virus actually can be confined if we perform isolation efficiently, also smartly. Okay, so the people with infected these viruses, actually most of them can recover. So that's very important. I think the Taiwan government actually did the right thing this time. They timely border control and also very promote, very and educate wearing masks to the Taiwanese people. That's very important, and also keep social distancing. So isolation for this disease, I think is a very important concept, and also very efficient for controlling the spread out of.
Okay, thank you, Dr. Lin. And the last question, we have time for the last question for you. Dr. Lin, what do you think, like during the corona virus outbreak, what is the biggest risk during the process of the IVF treatment? Do you think that we should take care of, even if it's in a more controlled region?
Oh, okay. Yeah, that's a good question. I think probably what I think the TLC strategy probably can give us a reference, because we do not provide services for the patient with infectious sign. Because if you do some cases with infection, your IVF lab, your clinic actually in a dangerous situation. Okay, and that probably will lead to shutdown of your clinic. So even the environment in Taipei is safe, we still keep very alert. Have two checkpoints in the building. Okay, I think that's my opinion.
Thank you, Dr. Lin. Sorry, according to your answer, I have a personal question for myself. Do you think in some areas that are probably not in Taiwan, probably a less controlled area, that having all the clinic staff or even the patients taking the PCR test or antibody test can be helpful for preventing this situation to happen, prevent all the risks?
I think that's one option. Yeah, that's good. That's good. Because if you still want to run your clinic and IVF work, I think the protection level, if you can have more protection level, that will be more confident and more sure for the safety of your clinic, and also for safety for most of the patients coming to your clinic.
Thank you very much. As we have the last minute, we found the last question from Japan. The doctor asked, what do you think about vertical transmission of COVID-19? Do you think vertical transmission is possible? And have you seen any data about that?
Yeah, I just heard one case report, so that's very rare. So at the moment, I won't think it's good for vertical transmission. I would say that would be rare condition.
I see. Okay. Thank you very much, Dr. Lin, for your excellent speech. Thank you very much. Thank you.
Thank you. Thank you, Andy.